here's Bill de Blasio announcing how in New York City, citywide employees, there are over 300,000 of them. Vaccinations are either going to be required by September or there's going to be weekly testing, which, like, not that big of a burden. That's not the NFL where there's more profit on the line. But the NFL, they're requiring daily testing for unvaccinated players and once every 14 days if you are vaccinated, which is interesting. But one's more important in terms of public service. It's just, I think, interesting how this is trending, because this could be the next step. We're seeing in France, there was a new requirement that you have to be vaccinated to go to some indoor venues. And Germany's considering some similar provisions. In the United States, it's a lot more dicey for a variety of reasons. Here's what de Blasio had to say in his announcement today, though.
On September 13th, which is the first full day of school, every single city employee will be expected to be either vaccinated or be tested weekly. This means everybody. This means, obviously, everyone who works in our schools, our educators and staff. It means the NYPD, the FDNY. It means all city agencies. It means people who work in offices and people who work on the front line. Everyone. Because September is when the rubber hits the road, and this is when we have to make the difference, and so this mandate will be in place.
I don't really know why it's September's when the rubber hits the road, but I'd imagine it seems a little arbitrary. But I think that he's trying to get it to line up with when kids are going back in school in person, which they've done polling, and a lot of that is, you know, more driven by upper to upper middle class parents who are more concerned about that, by the way, who are driving that conversation. But it is obviously, I think, a good goal to set. And I just wonder how many cities are going to follow suit after de Blasio kind of threw down the gauntlet here.
Well, I think some, but not a whole lot. I think until this actually starts putting people's kids in hospitals this fall, we're not going to see a serious national response to this. I'm afraid. And
it will. I mentioned this at the top of the show. The Delta variant, there's just, again, this is incredibly preliminary and we don't know exactly what's happening, but hundreds of children in Indonesia, where the Delta variant's running rampant, have died. Kids are going to start dying as this virus finds new ways to kill people and metastasizes and becomes something new so it can infect people more easily. This is just the reality of the situation. And the right wing that screams save the children, they are not so interested in saving the children from a virus changing so much so that it hurts kids in ways that we were told it was never going to. That's if you are for some reason watching this and are still vaccine hesitant, the number one reason you should get it is to protect kids. There needs to be enough adults who are protected against the virus so that it isn't spread to kids, and we don't see children dying from this virus once schools reopen in the fall, because they're going to, whether, you know, the bluest of states like it or not. This is going to be an issue.
And then, you know, it's like, what happens, the fact that we aren't vaccinating the whole world, what does the next school year look like in the next one?
Right.
Hopefully I'm hopeful that this is the last variant that we'll have to seriously deal with, but I'm not optimistic that's the case.
Exactly. It does speak to a significant arrogance that we have here, that we have vaccines fully available to us, and, you know, Africa as a continent is still not, you know, 2% vaccinated. Their healthcare workers can't get vaccines. As I mentioned, Southeast Asia is experiencing a ton of outbreaks and mass death, and they are unable to have access to some of these vaccines. So I don't know where this goes. I write down the cases on this little notepad every single morning, and 170% increase in cases in the last 14 days. 170%. I didn't think we'd see back of over 50,000 cases averaging a day. I didn't think we'd see that.
It's unfortunate because, like, I remember, there was talk of how the COVID scolds, what are they going to do when COVID's gone? And the unfortunate reality is that they've been proven right at every turn. Like, being overcautious about this thing is the right play. We're seeing spikes again.
Right.
In slightly positive news, it looks like the cases in India and the UK are falling slightly. So that's at least from the New York Times COVID tracking data over there. So hope maybe, listen, we hope there might be, some way forward out of this. So hopefully for us, but it has been a long road. So, and this is only just happening anyway. So India's already been devastated to begin with.
They're also just, the data that's coming out of India is some of the more unreliable data in the world. There was reports that said that it seems like Modi's government is downplaying at least 90% of cases, or, kind of pulling a Donald Trump situation where under prioritizing testing for PR purposes, doesn't get more cruel than that, but it makes sense for Narendra Modi.
Folks, there's more of what you've just saw where that came from. That's if you hit the subscribe and like button. Thank you. Really, thank you.